Okay. Good morning to one and all, and greetings from my side. I am Professor Dr. Deven Chopra from Saraswati Dental College and Hospital, Lucknow. First of all, before starting with my today's talk and caricature, I want to thank the organizing committee of Cynodent that once again they have invited me to put my insight in front of you on the very important topic, principles of tooth preparation. Next slide. Okay. So why tooth preparation? First of all, before discussing about principle of tooth preparation, we should know what is tooth preparation. In a layman term, tooth preparation is that preparation in which we reduce a natural abutment to an extent to cover it with a full veneer crown or a partial veneer crown. So according to Tillman, tooth preparation may be defined as the mechanical treatment of dental disease or injury to hard tissue that restores a tooth to the original form. According to Mazo, the mechanical preparation or the chemical treatment of the remaining, which enables it to accommodate a restorative material without incurring mechanical or biological failure. So, if you have a root canal treated teeth, or if you are going for a 3 unit or a long span bridge, for that you required a tooth preparation. That means if you are going to replace a missing, central incisor, assuming 1 1. So according to NT's law, you need two adjacent abutment which suffice the NT's law, and you prepare them. Finally, you make an impression, you send it to the laboratory. From there, they send you a raw restoration. You do the bisque trial, and finally, you again resend it back for the final processing. And when the lab wala sends you back, and then you fix the restoration with the appropriate amount of polluting agent. So, I'm requesting again, please next slide. Okay. So right now we are living in a world of advances in digital dentistry, and we talk about more and more of conservation. So here today I will be telling you, and I will be focusing on preventive or conservative prosthodontics. What is conservative tooth preparation? What is conservative prosthodontics? You might be aware of today, if you are having a root stump layer and there is no amount of periapical pathology, no, that means extensive amount of periapical pathology. What you can do, you do the root canal, you surface it with a post and core restoration, and you put a crown. Right now, in an era of all ceramic restoration, we are just shifting the whole thing from PFM and metal restoration to the all ceramic restoration. No doubt, in all ceramic crowns and bridges, you require maximum amount of tooth preparation. That means if you need a occlusal clearance on the functional curves, you require bare minimum of 2 mm of reduction. But in today's scenario, there are monolithic zirconias which are possessing the strength of almost 1200 megapascal to 1450 megapascal. Why this? If you are having less amount of occlusal clearance also, so you can provide that option to the patient with monolithic zirconias. Okay, so conservative tooth preparation is that preparation in which you ensure a proper geometry of your tooth preparation while predicting the long-term prognosis of your crown and bridge restoration. Next slide. Okay, so despite these advances, traditional crowns are still indicated for majority of patients. No doubt, we live in a world of metal-free restorations now, but there are certain clinical situations, and some cost-effective factors are also there. Some financial factors are also there with the patient, by which you have to go for porcelain fused to metal restoration. In layman term, we also term them PFM restoration. So in that case scenario, knowing principle of tooth preparation, whatever restoration you are deciding for your patient is a very important thing and a vital part of your tooth preparation. Next slide. Okay. Now, objective of the tooth preparation. So the objective of the preparation remain clearly defined, but the methods of securing these goals are constantly being revised. First, reduction of tooth in the miniature to provide retention. no doubt. If you land up in a over preparation, or if you reduce a tooth more than it is required, that means you are actually altering the geometry of the, your actual anatomy of the tooth preparation, which is not required. Okay. So in that case scenario, sometimes your laboratory personnel will tell you, doctor, no worry, we can put excess cement and we can, fix the area. It is not like that. By putting excess cement, you are again violating and you are again insulting the soft tissue around the natural abutment. So if there has to be a, crown root ratio, there has to be an optimal cervico-occlusal length or cervico-incisal length, which ensures good retention of your crown and bridge retainers. Second is your preservation of healthy tooth structure to secure resistance form. Next is provision for acceptable finish line. No doubt. What is finish line? It is your remainder and finish area of the crown and bridge, which you are putting on your natural abutment. The intimate contact of your restoration at this area, at finish line area, has to be apt. Otherwise, there will be percolation of fluid. Short margins of the restoration will lead to percolation of fluid, and in future, it will lead to secondary caries. Okay. Then the last is performing pragmatic axial tooth reduction to encourage favorable tissue responses from artificial crown contour. This we will discuss in our later slides. Next slide. Okay, so according to Dr. Rosenstiel, we broadly classified them into biologic principles, mechanical principles, and aesthetic principles. Biologic principle includes your conservation of tooth structure, avoiding over contouring, supragingival margins, harmonious occlusion. Harmonious occlusion means you should not leave any defective or deflective contacts. Okay, while finally fixing your restoration inside the patient's mouth. Protection against tooth fracture. Mechanical includes your retention form and your resistance form. And the last is your patient's expectations about aesthetics. That is minimal display of the metal if you are going for porcelain fused to metal crowns. Maximum thickness of porcelain occlusal surfaces. I have told you already about the occlusal clearance part, and your subgingival margins, which will again have a question of maintaining a proper oral hygiene also. Next slide. Now, damage to the adjacent teeth is prevented while you are doing the preparation. You might have encountered, you know, actually you are working on a rotary device which is giving you 1 to 1.5 lakh of RPM. Guys, please take a pause. Here, what you have to do, you have to go with low top handpieces if you are a beginner. Whenever you are starting your tooth preparation, please keep this in mind that while you are breaking the adjacent contact area, you should leave the lip of the enamel. And finally, when you are contouring it, you can easily break the lip of the enamel with a 0.2 millimeter contact breaking bar. Okay, next slide. Soft tissues, guys. Again, you have to respect the integrity and the consistency of the soft tissue. How you can do it? By proper isolation in a macroglossic tongue, and especially when you are preparing the lingual surface of your mandibular posteriors, the retraction with a swadopter or with any device which should not interfere while you are preparing a tooth. Otherwise, unnecessarily you are going to traumatize the lateral border of the tongue, and finally definitely the patient will be upset by, doctor, how you have hit my tissue, you have hurt my tissue. So you have to be very careful. Next slide. Well, guys, whenever you are going for a bridge preparation, I just wanted to clear you, there is a myth going on. Whenever you are replacing a missing tooth with a bridge or with a fixed partial denture, and a new terminology for FPD is FDP. So according to American Dental Association, it is termed as fixed dental prosthesis. So whenever you are going for a bridge, it is not mandatory to destroy the vitality of your tooth. Why? Why? Because vital pulp and vital tooth always ensure how much compression is required for the functional chewing, for mastication. Okay, so If the patient is having low pulp horns, you can easily go ahead with the vital tooth preparation. But whenever you are using your high torque hand pieces or even low torque hand pieces, the water coolant spray has to be apt. Otherwise, you will lead to extreme temperature, will lead to irreversible pulpitis, and you have to go for intentional root canal in certain cases when the patient is feeling sensitivity. Next slide. Now, according to Schillenberg, they have jolted it out. Again, we have read this in our older books also. First in the category is principle of preservation of tooth structure. Second is retention and resistance form. Next is structural durability and marginal integrity. And the last is preservation of the periodontium on whichever tooth you are playing with. Okay, next slide. We will take one by them hand in hand. So now what is preservation of tooth structure? You can check out in the schematics in the diagram on the virtual screen. You can see the person in a black and white diagram, how the rotary handpiece, how the burr is being kept parallel to the long axis or the axial surface of the tooth. So intact surfaces of tooth structure that can be maintained while producing a strong retentive restoration should be saved if the patient acceptance and retention requirements permitted. That means if not required, don't go ever with a if the your laboratory person says we need excess bulk for feldspathic porcelain. Feldspathic porcelain is your veneering porcelain. When you put it on a coping, in a metal coping or a zirconia coping, if you are using layered zirconias or layered TFM restorations, so there are four layers: base opaque, paste opaque, then you go with dentine, subsequent enamel, and glaze layer. So in this case scenario also, if it is not required, guys, I am requesting you don't go with excess preparation. Okay, so the amount of preservation of tooth structure will again claim a long-term prognosis of your future restorations. Next slide. You can check out in the diagrams a beautiful example of replacing the your congenitally missing lateral incisor. You can appreciate in the diagrams what the dentist have done. He has just given a facing, ceramic facing to ensure. You can check out in the second diagram in the upper area that he has only provided the metal part till cingulum area. So this is how you can also conserve the tooth structure when the anterior region is exposed. So why to go for excess reduction if it is not required, especially when you are dealing with young patients aging between 30 to 35, where the pulp horns are very high and the patient during the preparation can complain of sensitivity. Okay, next slide. Now, next is retention and resistance. Guys, I'm telling you, it goes hand in hand. Without retention, there is no resistance. Okay, so that means the geometrical configuration in the starting of my lecture, I have told you the geometrical configuration of the tooth preparation must place the cement in compression to provide the necessary retention and resistance form. That means proper parallelism of the proximal surface, excuse me, and your occlusal surface, especially your cervico-occlusal length. If it is apt, you can get very good retention also. And we always say, whenever you are checking that, crown at a whisk trial state inside the patient's mouth, there has to be a snug fit. That means whenever you are removing it, it has to, you require certain amount of pull stroke to remove the restoration. That means you are ensuring proper parallelism of your restoration, which will further give you better resistance of the restoration also. Okay, next one. Now, retention, we have already read in our prosthetic books, prevents removal of restoration along the path of restoration or long axis of tooth preparation. Resistance is what? It prevents dislodgement of the restoration by forces directed in apical or oblique direction. Next slide. Taper. Guys, check out the diagram and you can see the taper of your restoration is a very, very important aspect when you are achieving or when you are trying to achieve resistance form. How? The axial walls of the preparation must taper slightly to permit the restoration to see. Okay, that means minimum of 6 degree of taper is required. How you can achieve it? You just don't have to do. Please go back to your places and take your diamond burr, your tooth preparation burr, and just measure the angle. You will see whenever you are putting that burr along the long axis of your tooth, okay, that ensures already 3 degree of taper. I will show you in the further diagram. So from one side of the proximal surface, it is 3 degree, and another side, it is 3 degree. When we join them, you achieve 6 degree of taper. Angle of convergence and angle of divergence can be used to describe the respective relationship between the two opposing walls of a preparation. Okay, so the relationship of one wall of a preparation to the long axis of the tooth, that preparation is the inclination of that wall. Next slide. A tapered diamond or burr will impact an inclination of 2 to 3 degrees, as I've already quoted. You can check in the yellow diagram. Okay, and you can see in the photograph also of the tooth preparation, this burr, according to the manufacturer, it is being carved actually with a 3 degree rate angle. Okay, so the yellow diagram depicts the both the angles. You can check out the burr direction along the long axis of the parallel and both the proximal surfaces when you are preparing it and when you are achieving the preparation, tooth preparation, you will be achieving 6 degree of taper, and that is apt for your retention as well as resistance form. Next slide. Now, these are the authors, different authors, which have given, according to the researchers, they have given different degree of tapers. But my recommendation as a prosthodontist, as a general dentist to you, 6 degree or maximum amount of 10 degree. More than 10 degree is not permissible, is not acceptable for any crown and bridge preparations. Next slide. Consciously attempting to cut a taper can easily result in an over-tapered and non-retentive preparation. How does this happen? You have, seen some amount of tilting while you are going for your, tooth preparation adjacent to the edentulous segment. Long-term edentulism will always lead to the mesial migration. We have already read in our second year BDS in our Wheeler's dental anatomy. So they say if the patient is not going to get her or his teeth replaced within a span of time, there will be a mesial migration of the natural existing abutment. And what happens? It confuses the operator that we have read in a principle that we have to go along the long axis parallel. So what we do accidentally do, we just tilt the burr according to the inclination of the tooth. Never do that. Okay, why? There might be a confusion looming over what sir is telling us. That means if you are tilting the burr according to the tilt of the restoration, you are accidentally, giving the undercut to the prepared tooth. And finally, what will happen? Your whatever impressions you are going to send it to the laboratory, he has to manage the tilt. Otherwise, whatever wax pattern he's fabricating on that natural abutment, the moment he will pull out, it will give resistance, but what is going to happen? It will tear from the finish margin, and accidentally, when he block out the undercut and maintain the, fabricate the crown on it, what is going to happen? There will always be short margin. So, whenever you are preparing your tilted abutments, guys, please always, I know, maintain the long axis. You will land up in a over preparation. But there are certain auxiliary aids by which you can overcome the disadvantages of over contoured preparations also. How? I will tell you further by incorporating proximal boxes, grooves, and so many retentive features which can aid in the retention of your final restorations. Next slide. Now, freedom of displacement. This is another important entity. Maximum retention is achieved when there is only one path. And if you accidentally create multiple paths of insertion, definitely your crown and bridge is not going to last for long. So, a full veneer preparation with long parallel axial walls and grooves would produce such retention. Limiting the freedom of displacement, as I have told you, how you can limit it? By only giving one path of insertion. Okay, from torquing or twisting forces in a horizontal place, which leads to increases the resistance of your final restoration. Next slide. Okay, beautiful depiction without any legends over there. You can check out these two. I have was talking about the over preparation. You can see the taper of both the preparation is very much high. In the first diagram, the black arrows are depicting multiple path of the insertion and withdrawal. So what is going to happen? It will lead to failure of your final crown and bridge. Patient will come within the span of few months or few days. Doctor, sir, whatever you have done, it is coming out of. It is coming out. So it is a very embarrassing situation for the operator too at time. So now what you have to do, you cannot unnecessary drill the area, put a post, make a core build up, and then send the impression. No, whatever over preparation has been done, you can check out in the second diagram. By placing proximal grooves, you can reduce the dislodgement and you can ensure freedom of displacements also. Okay, next slide. Surface area, another important thing. Whenever you are placing a luting agent on the tissue surface of your crown or bridge procedure, so the total surface area of the preparation is influenced by the size of tooth, as I have already quoted, the extent of the coverage by the restoration, and internal features such as grooves and boxes will give you maximum amount of retention form. And more the surface area, wettability of the cement on the tissue surface, as well as on the natural tooth surface, it create a bond, a chemical bond. The chemical bond will be strong, and finally it will give you a good restoration, a fruitful restoration. Next slide. Area under shear. Again, it comes along with, if you are, for the shear strength of the cement to be utilized, the preparation must have the opposing walls nearly parallel with each other. If you accidentally or intentionally induce an undercut in the proximal surface, in one proximal surface or both the proximal surface, definitely, again, you can check out the B diagram. The schematic shows over convergence. So what is going to lead? Again, multiple path of insertion, and your crown is going to be loose, whatever cement you use. If you fix it with the Fevikwik, that is altogether a different thing, but you cannot use Fevikwik intraorally. You have to go with either GICs, glass ionomer cements, or your resin glass ionomer cement. So shear is something really important. Okay, next slide. Now, types of preparation, you can check out different types of preparations have different retentive values, and these correspond fairly closely to the surface area of the axial walls, provided the other factors like your taper. So adding grooves, you can see in the diagram, or boxes or pinhole will always give you a good amount of retention as well as resistance form in your preparation. Okay, next slide. So for the grooves to be effective, you can check out the diagram A and diagram B. The lingual wall of the groove must be distinct and perpendicular to the adjoining axial wall. This is the very, very important thing to understand. Okay, whenever you are creating a proximal groove. So the walls of a groove that meet the axial wall at an oblique angle do not provide necessary resistance, as you can check out on the A diagram. And in the B diagram, you can see the walls of a groove must be perpendicular to the rotating forces to resist displacement. Next slide. Length of the preparation is an important factor in retention. Longer preparation has a greater retention than does a short preparation due to greater surface area. Because of greater surface area preparation with larger diameter will have greater retention than with narrow preparation of the same length. So I have already told you, there has to be a minimal 1:1 ratio of crown and root. If you are not maintaining, if you are not respecting the occlusocervical geometry of your preparation, definitely you cannot ensure a better prognosis of your future crown and bridges. Next slide. Surface roughness, no doubt. You can see the schematics on the slide. One is coarser surface and another one is little bit of denser surface. So right now, according to the recent consensus, recent scientific literature, you can check out and scroll it down on Google it down. Right now, there are recommendations before fixing your crown or bridge on the natural abutment or on a tooth. You should sandblast the area properly. Even right now, there are recommendation of air polisher being used on your natural abutment. What does it do? It enhance your chemical retention. And how you achieve chemical retention? By using appropriate amount of luting agent. And how it can ensure or enhance? By inducing surface roughness with the help of sandblasting procedure. Next slide. Now, resistance prevents dislodgement of restoration by forces directed in the apical or oblique direction. We have already discussed. Leverage and resistance. Leverage is the predominant factor in the dislodgement of the cemented restoration, which occur when line of action of force passes outside the supporting tooth structure. So, as I have already told you, length of the preparation has a strong influence on its resistance. Shortening a preparation will produce a proportionally greater diminution of the resisting area. So finally, what will happen? If you land up in an over preparation, your resistance form will be compromised. Next slide. A short restoration or a short preparation is less likely to fail through tipping than is a long preparation on the same preparation, as the force on it acts through a longer lever arm. Please remember your lever principles, class 1, class 2, and class 3 lever. So a preparation on a tooth with a smaller diameter resists pivoting movements better than a preparation of equal length on a tooth of larger diameter. Next slide. Path of insertion. I have already discussed this. Path of insertion, whenever you are finishing your preparation, please always, before making a definitive impression, this is a trick, always do a check model. Okay, how? You can take a partial trace, you can take your irreversible hydrocolloid, make an impression, pour a model with a gypsum dental plaster, okay, and ensure if there is any undercut, please finish it or remove the undercut area with the help of your yellow band diamonds. Okay. And then you go with a definitive impression. Next slide. Structural durability. Now, what is this structural durability? The structural durability comes when a restoration must contain a bulk of material that is adequate to withstand the forces of occlusion. What does this mean? This is when I have told you when I was dotting out the principles of the preparation. How you achieve structural durability. Whenever you are using TFM restoration or veneering porcelain restorations, there has to be apt amount of occlusal clearance. Your laboratory personnel won't be able to give you if good aesthetic and good amount of thickness of pathic porcelain on the metal coping, unless until you appropriately provide him a good functional cusp clearance as well as a non-functional cusp clearance. So whenever you are doing your preparations, please make sure according to the type of restoration, you provide apt amount of your functional cusp clearance as well as non-functional cusp clearance. More the clearance, definitely you will get better amount of structural durability. And there are three preparation features that contribute to the durability of the restoration. That is your occlusal reduction, your axial reduction, and provision for reinforcing struts. Next slide. Occlusal reduction. One of the most important features is your occlusal clearance. So for gold alloys and for any alloys, 1.5 millimeter of clearance on the functional cusp is the must thing, and 1 millimeter of clearance on the non-functional cusp. In upper, your functional cusps are your palatal cusp or lingual cusp. In lower, your functional cusp are your buccal cusp. Next slide. So metal ceramic crowns will require 1.5 to 2 millimeter on the functional cusp and 1 to 1.5 millimeter on non-functional cusp. And there should be 2 millimeter of clearance on preparation for your metal-free or all ceramic crowns and bridges. Next slide. Functional cusp bevel. This is something really important. You can check out the schematics in the upper and lower preparation. Both functional cusp bevel is something really important. Now, what is this functional cusp bevel? A wide bevel on the lingual surface of the maxillary lingual cusp and the buccal inclines of the mandibular buccal cusp provides space for an adequate bulk of metal. So, if you leave a sharp edge, what is going to happen? There will be a stress concentration on that sharp area, sharp line angle, and it will lead to what? It will lead to either chipping of your feldspathic porcelain, or at sometimes in heavy masticatory occlusal load, it can even fracture your crown from that particular area. Okay, so functional cusp bevel is something really important. Next slide. To prevent a thin casting when there is no functional cusp bevel, an attempt may be made to wax the crown to optimal thickness in this area. So, an over-contoured restoration will result and a deflective occlusal contact is likely to occur, which can create TMJ problems also. Next slide. Axial reduction. So second prerequisite for structural durability is axial reduction. When it is sufficient, restoration walls have satisfactory thickness without over contouring. What is reinforcing structure? The features that serves to provide space for the metal that will improve the durability and the rigidity of the restoration. How? Offset the occlusal shoulder, the isthmus, the proximal grooves, and the box. What happens actually, isthmus connects with the boxes and the offset ties the groove together to enhance the reinforcing truss effect, which you can see in the diagram. And how does the truss effect work? The offset ties the grooves together, the isthmus connects the boxes, and the truss effect resists distortion from applied forces in any direction. It can be vertical and it can be horizontal forces. Okay, next slide. Marginal integrity. I've already told you that what is marginal integrity? It is your finish line of the preparation. It is your finish line of the preparation. So the restoration can survive in the biological environment of the oral cavity only if the margins are closely adapted to the cavo surface finish line of the preparation. The configuration of the preparation finish line dictates the shape and bulk of the restorative material in the margin of the restoration, and it also can affect both marginal adaptation and the degree of seating of the restoration. And I have already told you, if you are not using a end cutting bulb, definitely it will lead to irregular finish margin and your restoration seating will be a problem. And if you put excess cement, cement leaching will lead to your gingivitis, and even you in due course of time, you if you don't treat leach that cement inside the gingival crevice, it will lead to your periodontal pocket formation. So you have to be very careful. Next slide. Finish line requirements. You can check out the diagrams. A beautiful depiction of the finish line. The point at which a preparation terminates on the tooth is called the finish line. It is also defined as the peripheral extension of a tooth preparation according to the glossary of prosthodontic terms. Next slide. There are three requirements for successful restoration margins. They must fit as closely as possible. I have talked about the intimate contact. They must have sufficient strength to withstand the forces of mastication. And lastly, whenever possible, they should be located in areas where the dentist can finish and inspect them. And one thing from my side is, you always keep a finish line in any type of restoration at equigingival level. So it ensures two things. It can also ensure your aesthetics, and patient will be able to maintain his oral hygiene status equally. Next slide. So functions, we have discussed the finish line serves better adaptability. Finish line is one of the features that can be used to evaluate the accuracy of your impression also. And it also helps in dye trimming, and the correct marginal adaptation of your wax pattern depends on an obvious finish line. Next slide. Now, we will discuss one by one different type of finish line. You can check out in the diagram. I have given you the whole, in a single tooth, I have tried to show all the finish line. So first is the chamfer finish line. Chamfer finish line, the preferred finish line for the veneer metal restoration when you are going for full cast metal, crowns and bridges. This finish line has been shown experimentally to exhibit the least amount of stress and better adaptability at your junction area. Okay. Next, heavy chamfer finish line. What is this? Sorry, can you go back to the previous slide? Yeah. Heavy chamfer finish line. A heavy chamfer is used to provide a 90-degree cavo surface angle with a large radius rounded internal angle. Heavy chamfer line are the finish line of choice whenever you are going for your all ceramic crowns and bridges. Okay, I'll tell you later. Next slide. Shoulder. You can check out the diagram. Earlier, it was a recommendation. Whenever you are going for all ceramic crowns and bridges, shoulder is the finish line of choice. And shoulder, the wide ledge provides resistance to occlusal forces and it minimizes stresses that might lead to fracture of the force lead. It produces the space for healthy restoration, contours, and maximum aesthetics. However, it does require destruction of more tooth structure. You can check out in the black and white diagram. The width of the shoulder is comparatively bigger in comparison to your chamfer or your heavy chamfer finish line. Next slide. Shoulder with bevel. This is another important finish line with a bevel is used as a finish line in variety of situations. It is utilized as a gingival finish line on the proximal box of inlays and onlays. Okay. So, and for the occlusal shoulder of your onlays and even mandibular 3/4 crown. This design can also be used for the facial finish line of metal ceramic restoration, where gingival aesthetic is not a critical thing. Next. Shoulder with bevel. I think I have already done this. Next slide. Knife edge. Guys, I will never ever recommend as a prosthodontist or as a general dentist, you go with knife edge. Knife edge, are right now it's an obsolete finish line. We hardly use in any kind. But there is only one clinical situation whenever you are going for tilted tooth preparation, you can go ahead with knife edge. But it is not a good finish line whenever you are going your monolithic zirconias or all ceramic crown. Actually, if you are going with your porcelain fused to metal restoration, you can go ahead with knife edge finish line. But again, the situation is it has to be a 30 margin of metal. No doubt, if you check out the compatibility, it is even better than your chamfer finish line. But I have told you in literature, there is only one clinical situation where you can provide this knife edge finish line. And what is that situation? Whenever you are working on a tilted natural abutment. That means if your natural abutment is tilted around 40 to 45 degree. So to while during excess preparation, definitely you will lead in a over preparation. And for that preparation, you have to give a lingual knife edge finish line. But try always avoid giving these knife edge. And for all ceramic restoration, you can never go ahead with this knife edge finish line. Okay, next slide. Feather edge. Again, this is also obsolete design when we talk about finish line. A feather edge finish line is unacceptable because it is not sufficiently distinct and results in so little cervical tooth reduction that the restoration must be over-contoured to possess adequate rigidity. Next. Instrumentation. I have told you at a beginner's choice, always go with low torque handpieces that gives you a maximum amount of RPM of 1 lakh RPM. And The clinical trick here is please ensure your coolant, that means your water spray, water jet, which is coming to cool your burr diamond when it is cutting. Cause whenever you are using diamond burrs for your tooth preparation, it induces greater amount of heat. So ensure a proper flow of coolant while you are preparing a natural abutment or even a root canal treated or a non-vital tooth. Next. There are basically three main rotary instruments which we used in tooth preparation on a routine basis. One is, you can see, check out the diagrams. First is your diamond stone. Second is your tungsten carbide bird. And third is your twist drill. My favorite is almost diamond stone. And in each way, shapes and sizes, right now, so many manufacturers are there which provide your diamond in each and every grade. There is a different situation where we use tungsten carbide burr. Tungsten carbide burr is only used whenever you are using removing a faulty prosthesis or faulty crown or bridge. And twist drill, I'll tell you further on. Next slide. Diamond stones, as you can check out the diagrams, there are round end tapers, there are flat end tapers, there are chamfer burrs, there are shoulder burrs, and a wheel burr, as depicting in the diagram. So numerous small irregularly placed sharp diamond chips are electroplated with a nickel or chromium bonding medium to steel instrument blanks, whose head is machined to the desired final shape of the instrument. This is basically the manufacture and how they manufacture these diamonds. So right now, they start with coarse grit, a black or blue one. Then when you are in the mid of the preparation, you use your red coated diamonds. And finally, whenever you are finishing your preparation, you can go ahead with your yellow diamonds, yellow band diamonds. Next slide. Tungsten carbide. They are best suited for making precise preparation features and smooth surfaces on enamel and dentine. Here, I don't accept this point because actually, whenever you try to use tungsten carbide burrs, they induce heat also, and definitely their fluids are very sharp. No doubt, they give you better cutting efficiency in comparison to diamond burrs, but they always land up in you will land up in a excess tooth preparation. So always use tungsten carbide burrs whenever you are using a faulty prosthesis from the patient's mouth. Next. Your twist drill. So you can check out in the schematics, there are two sizes of twist drill. First picture is of your 0.6 millimeter twist drill, pin holes for parallel pins for cast restoration. Whenever you are going for pinledge restorations, you can use this twist drills. And 0.5 millimeter codex drill, the second one, used for creating pin holes for minimum threaded pins, which retain your amalgam and your composite cores. Next. Dual instrumentation. This is something really important. Diamond burrs cut through enamel more efficiently than carbide burrs, but they leave micro scratches on the surface, reducing the finish of the preparation. You can check out diagrams. No doubt, right now, treated diamond burrs, okay, coated diamond burrs with high amount of rake angle give you better cutting efficiency in comparison to tungsten carbide. But earlier, previously, when they were not treated, tungsten carbide burr was got a better cutting efficiency, as I have already told you. You can check in the black and white diagram. In the first diagram, you can see there is a roughness kind of a thing. So before making a definitive impression, you should smoothen these areas. Otherwise, this will give you a false appearance of a sandblasting kind of a thing. And if you are not smoothing your preparation, definitely these scratches will lead to debonding of your final restoration at times. So you finally, before making a definitive impression, you have to smoothen up your preparation with a yellow band. Next. Common errors of the tooth preparation. So insufficient occlusal or incisor reduction, minimal axial reduction on the buccal and lingual surface of the posterior teeth, inappropriate proximal reduction, over reduction undercuts on the distolingual surface of the preparation, and or lack of parallelism while you are preparing your natural abutment for your fixed dental prosthesis, and failure to contour proximal surface of adjacent teeth to allow seating of your restoration. Next. Okay. Finally, now the come aesthetic consideration. My recommendations as a restorative dentist, as a prosthodontist, to you, to all of you listening to me, is that first of all, whenever you are communicating with the patient, please read the patient's mind first. That confrontation, that communication will actually tell you when how much patient how much patient is expecting, what are his aesthetic expectations. Guys, please don't delve into the patient's expectation. Here is a clinical tip which I am giving you. In first communication, whatever patient's expectations are high, please in restoration, sorry, first confrontation, you should put the patient's expectation to a down. And if you put it down, your hard work definitely is going to be appreciated by the patient. So you should meet the patient's mind first before actually start working on the patient. This is how you can achieve and give good aesthetic restoration, your crowns and bridges. Next. So to finally conclude my session, I will tell you principle of tooth preparation, where whenever you are using your metal freeze or all ceramic or any PFM restoration, any cast metal restoration, the funda is you cannot defy the principle of your tooth preparation. So how much preparation you have to achieve, it has to be optimal in nature to give better prognosis and better outcome of your final results. So that's all from my side. Thanks for the patience hearing, and now I'm open to your Q&A, question and answer. Thanks the organizer for providing me. Thank you.